Hello, my name is Dr. Carlo Oller. I am an emergency physician and I make patient education videos and publish them on PatientEducation.Video. For many more videos like this one, go to PatientEducation.Video. In this video, we're going to talk about fibromyalgia and we're going to take a deep dive into what is fibromyalgia, how is it treated, what should you watch for, what is the follow-up. So, without further ado, let's get started. So what is fibromyalgia? Fibromyalgia is one of a group of chronic pain disorders that affect connective tissues, including the muscle, ligaments, and the tendons. The tendons are those things that attach the muscle to the bone. It is a chronic condition that causes widespread muscle pain. That's why it's called myalgia. It also causes extreme tenderness in many other different parts of your body. Many patients experience fatigue, sleep disturbances, headache, and mood disturbances such as depression and anxiety. Despite ongoing research, the cause, diagnosis, and optimal treatment of fibromyalgia is not clear. In the United States, fibromyalgia affects about 2% of people by age 20, which increases to approximately 8% of people by age 70. It is the most common cause of generalized musculoskeletal pain in women between 20 and 55 years of age. It is more common in women than it is in male. Now, let's talk about the cause of fibromyalgia, which is actually unknown. There are various physical or emotional factors such as infection, injury, and stress that may play a role in triggering the symptoms, although many patients report a lifelong history of chronic pain. In people with fibromyalgia, the muscles and tendons are excessively irritated by various types of painful stimuli. This is thought to be due to heightened perception of the pain, a phenomenon called central sensitization. Other conditions may also develop as a result of central sensitization, including irritable bowel syndrome or IBS, chronic fatigue syndrome or CFS, chronic headaches, chronic pelvic and bladder pain, and chronic jaw and facial pain. There is no generally agreed upon explanation for how or why central sensitization develops in some people. The most likely theory suggests that there is a genetic component, meaning that some people are just predisposed to having a heightened perception of pain. People with a parent or sibling with fibromyalgia have a higher chance of developing it themselves. In some cases, there's various stressors, including infection. Some theories are Lyme disease and viral illness, and diseases that involve the joint inflammation like rheumatoid arthritis, systemic lupus erythematosus. Physical or emotional trauma, sleep disturbances appear to trigger the development of fibromyalgia. Brain imaging studies in people with fibromyalgia and related chronic pain disorders have shown changes in brain function and the connections between different parts of the brain. As research continues, the factors that lead to chronic pain in fibromyalgia will be better understood, hopefully allowing to the development of better treatments. Can fibromyalgia be cured? Well, some people seem to get over the fibromyalgia, but in most people it cannot be cured. Even so, people can learn to deal with the condition and lead fairly normal lives. Fibromyalgia does not get worse over time and it is not life-threatening. Does fibromyalgia cause symptoms besides muscle pain? The primary symptom of fibromyalgia is widespread or diffuse chronic and persistent pain. Although the pain is felt in muscles and soft tissue, there are no visible abnormalities in these areas. The pain may be described as a deep muscle ache, soreness, stiffness, burning, or throbbing pain. Patients may also feel numbness, tingling, or unusual crawling sensation in the arms and the legs. Although some degree of muscle pain is always present, it varies in intensity and is aggravated by certain conditions such as anxiety, stress, poor sleep, exertion, exposure to cold or damp conditions. People often describe their muscle symptoms as feeling like they always have the flu. The pain may be confined to specific areas, often the neck and shoulders, early in the course of the disease. Multiple regions are eventually involved, with most patients experiencing pain in the neck, middle and lower back, arms and legs, and chest wall. Areas called tender points can feel painful with even mild to moderate pressure. Many patients with fibromyalgia feel that their joints are swollen, although there is no visible inflammation in the joints, as would be found in forms of arthritis. Other pain symptoms. Patients with fibromyalgia are often affected by other pain-related symptoms, including repeated headaches like migraines. Also, symptoms of irritable bowel syndrome or IBS, including frequent abdominal pain, episodes of diarrhea, constipation, or both. Interstitial cystitis, painful bladder syndrome in which bladder pain, urgency, frequency are typically present without an infection. TMJ syndrome or temporomandibular joint disease, which can involve limited jaw movement, clicking, snapping, popping sounds while opening and closing the mouth. Pain within the facial or jaw muscles in or around the ear, or headaches. Fatigue and sleep disturbances. Persistent fatigues occur in 90% of people with fibromyalgia. Most people complain of unusually light or unrefreshing or non-restorative sleep. Difficulties falling asleep, awaking repeatedly during the night, and feeling exhausted upon awakening are also common problems. People with fibromyalgia may also have sleep apnea, when the person stops breathing for a few moments while they are asleep, or restless leg syndrome, when there's uncontrollable urge to move the legs during the night. Like some painful conditions, these sleep problems might also be triggers of fibromyalgia. If you have one or both of these problems, your doctor will likely recommend a formal sleep evaluation to confirm the diagnosis. There appears to be a close relationship between fibromyalgia and chronic fatigue syndrome, CFS, which is primarily characterized by chronic debilitating fatigue. Most patients with CFS meet the tender point criteria for fibromyalgia, meaning that they have pain in many areas commonly affected in people with fibromyalgia, and up to 70% of those with fibromyalgia meet the criteria for CFS. A better understanding of both conditions is needed to clarify how are they related. Depression and anxiety. Many people with fibromyalgia also have depression and/or anxiety at the time of diagnosis, or develop it one or both later in life. However, this is true of most chronic painful conditions, and fibromyalgia is not simply a physical manifestation of depression. Now let's talk about the diagnosis. There are no specific laboratory or imaging tests used to diagnose fibromyalgia. Thus, the diagnosis is typically based upon a thorough patient history, a complete physical exam, and a limited number of blood tests, which are mainly used to exclude other conditions with similar symptoms. Different diagnostic guidelines have been used, and different healthcare providers may vary in their process, but all approaches involve evaluating the pain, fatigue, and other symptoms that may be related. The American College of Rheumatology, the ACR, developed a classification criteria for fibromyalgia in the 1990s that have often been used to help make the diagnosis. According to those criteria, a person can be diagnosed with fibromyalgia if he or she has widespread musculoskeletal pain and excess tenderness in at least 11 of 18 specific tender points based on clinical examination. The ACR released an updated diagnostic criteria in 2010. These criteria do not require the tender point examination, but use a numerical scoring system based on how widespread and severe the person describes the pain to be. They also consider other symptoms such as fatigue, cognitive problems like trouble thinking clearly, and other pain-related issues such as headache or digestive problems. Diagnostic criteria proposed by the Addiction Clinical Trial Translations, Innovation Opportunities and Networks, the ACTION, American Pain Society, the APS, and Pain Taxonomy, AAAPT, include multi-site pain, Define at least 6 out of 9 possible sites and moderate to severe sleep problems or fatigue present for at least 3 months. If you have symptoms of fibromyalgia, your doctor should obtain a medical history and do a physical exam to rule out arthritis and other connective tissue problems, neurological conditions, and other disorders that may be causing your symptoms. Routine laboratory tests may be recommended to help exclude certain conditions such as inflammatory arthritis, thyroid disease, and disorders of the muscles themselves. Results of these tests should be normal in most people with fibromyalgia. Because people with fibromyalgia frequently have symptoms besides muscle pain, including persistent fatigue, headache, additional pain symptoms, sleep and mood disturbances, your doctor may also suggest the following: informal or formal evaluation of mood problems such as depression or anxiety. If you have symptoms of depression or anxiety, you may be referred to a mental health specialist for further evaluation and treatment. A thorough sleep history. If your sleep history suggests a sleep disturbance such as restless leg syndrome or sleep apnea, you will be referred to a sleep specialist for additional evaluation and treatment. Conditions that can be similar to fibromyalgia. The process of determining whether a person's signs and symptoms are related to fibromyalgia or to another condition can be lengthy and very complex. Many illnesses can cause generalized muscle aches, fatigue, and other common symptoms of fibromyalgia. It is important to note that fibromyalgia can occur in people with rheumatoid arthritis, systemic lupus erythematosus, osteoarthritis, and other conditions. If this is the case, it may be difficult to determine whether your symptoms of chronic pain and fatigue are caused by fibromyalgia or your other condition. Often this will require consultation with a rheumatologist. The following is a sample of disorders that your doctor may consider during the diagnostic process: rheumatoid arthritis or RA and systemic lupus erythematosus SLE. RA is a chronic disease that causes inflammation of joints resulting in pain, swelling, and potential deformity of the affected joints. SLE is also a chronic inflammatory disorder of the connective tissues that can affect multiple organs. Although both RA and SLE share many symptoms with fibromyalgia, they have other features that are usually not seen in people with fibromyalgia, including inflammation of the synovial membranes, that's the connective tissue that lines the spaces in between the joints and the bones. Osteoarthritis, OA, causes stiffness, tenderness, pain, and potential deformity of affected joints, and it most commonly occurs in older individuals. Doctors can differentiate OA from fibromyalgia based upon a person's medical history, physical examination, and results of x-rays, where we can actually show degenerative joint changes in the joint that should not be present in fibromyalgia. Ankylosing spondylitis, AS. This is a chronic, progressive, inflammatory disease involving joints in the spine. This condition leads to stiffness, pain, and decreased movement of the spine. Ankylosing spondylitis also causes characteristic findings that can be seen on an X-ray, which are absent in people with fibromyalgia. By contrast, spinal motion and X-rays are usually normal in fibromyalgia. Polymyalgia rheumatica, or PMR, is an episodic, chronic, inflammatory condition that causes stiffness and pain in the shoulders, hips, and other areas of the body. PMR, which primarily affects people over the age of 50, is frequently associated with inflammation of certain large arteries. PMR is differentiated from fibromyalgia based on a patient's history, physical examination, and blood tests. Hypothyroidism and other endocrine disorders. Decreased activity of the thyroid gland, known as hypothyroidism, can cause fatigue, sleep disturbances, and generalized aches, similar to those with fibromyalgia. Blood tests to measure thyroid function are routinely conducted to help exclude the presence of hypothyroidism. Other endocrine disorders, including increased activity of the parathyroid glands like hyperparathyroidism, can also cause symptoms similar to fibromyalgia. Muscle inflammation or myositis or muscle disease due to metabolic abnormalities like metabolic myopathy. These conditions cause muscle fatigue, weakness, compared to widespread pain seen in fibromyalgia. In addition, patients with myositis typically have abnormal levels of the muscle enzymes. Neurologic disorders. These may include disorders of the brain and the spinal cord, the central nervous system, or the nerves outside the peripheral nervous system. A thorough neurological examination can assist in differentiating fibromyalgia from these neurological diseases. So, finally, how is fibromyalgia treated? Well, ideally, the treatment of fibromyalgia should involve you and your doctor, as well as in many cases, physical therapy, mental health expert, and other healthcare professionals. It may help to keep the following in mind. Fibromyalgia is a real illness, and your pain is not all in your head. Fibromyalgia is not a degenerative or deforming condition, nor does it result in life-threatening conditions. However, treatment of chronic pain and fatigue is challenging, and there are no quick cures. Treatments are available. Medications may be helpful in relieving pain, improving the quality of sleep, and improving your mood. Exercise, stretching programs, and other activities are also important in helping manage your symptoms. An approach that involves combining multiple different types of interventions into an organized treatment program is usually best. Being physically active will not cause harm or long-term muscle damage, and it can help improve pain and function. Understanding fibromyalgia and accepting that its cause is not well understood may help to improve your response to the treatment. As an example, some people believe that their illness is due to an undiagnosed or persistent infection. However, there is no evidence that this is true. Learning about fibromyalgia, as well as some of the common myths, may help you cope better with your symptoms. It is important to try to have a realistic expectation about fibromyalgia and how much it can be managed. Symptoms often increase and decrease over time, but some degree of muscle pain and fatigue generally persists. Nevertheless, most people with fibromyalgia improve, and most people lead full and active lives. So let's talk about medications. In addition to exercise and coping techniques to help manage symptoms, some people with fibromyalgia can benefit from medications. These medications have been most effective in relieving symptoms of fibromyalgia in clinical trials are drugs that target chemicals in the brain and the spinal cord that are important in processing pain. This includes some of the medications usually used to treat depressions, like antidepressants and epilepsy anticonvulsants. By contrast, medications and techniques that work to decrease symptoms of pain locally, such as anti-inflammatory drugs and analgesics, are less effective. The best medication for you will depend on your symptoms, preferences, cost concerns, as well as which drugs are available in your area or your country. Your doctor can talk to you about the options and how to begin medication therapy. In general, medications usually start at a low dose and then increase slowly as needed. Antidepressants. There are several different classes of drugs used to treat depression. Some of these can be effective in treating fibromyalgia symptoms as well. The TCAs, or tricyclic antidepressants. These drugs are often used first in treating fibromyalgia. Examples of these include amitriptyline and nortriptyline. Cyclobenzaprine, a closely related medication, may help in treating fibromyalgia, but it's not effective for depression. Taking TCAs before bedtime may promote deeper sleep and may alleviate muscle pain. Lower doses are usually used in fibromyalgia than the doses needed to treat depression, but even when taking low doses, side effects are common. They may include dry mouth, fluid retention, weight gain, constipation, and difficulty concentrating. Dual reuptake inhibitors. These drugs, also called serotonin norepinephrine reuptake inhibitors, can help with symptoms of fibromyalgia as well. They include duloxetine and milnacipran. The most common side effects are nausea and dizziness, but these are generally more tolerable if the doses start at a low level and increased very slowly. Selective serotonin reuptake inhibitors, or SSRIs, such as fluoxetine and paroxetine, may also be effective in fibromyalgia. These are a group of antidepressant drugs that work to increase concentration of serotonin in the brain. Serotonin is a naturally produced chemical that regulates the delivery of messages between the nerve cells in your brain. Anticonvulsants. Certain anticonvulsants, like drugs primarily used to treat epilepsy, may help relieve pain and improve sleep. They include pregabalin and gabapentin and are thought to relieve pain by blocking certain chemicals that increase pain transmission. The most common side effects of these drugs include feeling sedated or dizzy, gaining weight, or developing swelling, especially in the lower legs. However, most people tolerate these medications very well. Other drugs. You may wonder about other medications for treating your symptoms. However, evidence is limited, and it's important to talk to your doctor about your situation and what approach is most likely to help you. Fibromyalgia does not cause tissue inflammation, thus neither NSAIDs, non-steroidal anti-inflammatory drugs such as ibuprofen, Advil, Motrin, naproxen, Aleve, nor glucocorticosteroids like steroids are effective in relieving the symptoms of fibromyalgia. Analgesics like pain-relieving medications are sometimes added to fibromyalgia medications for people who need additional short-term pain relief. They include acetaminophen, Tylenol, and the prescription medication Tramadol. A sample brand name is Ultram, which may be used alone or in combination. Tramadol is an opioid. Although it is weaker than other opioid drugs, it's less likely to result in addiction. It may cause dizziness, diarrhea, sleep disturbances in some people. There is no evidence that long-term opioids are effective in treating fibromyalgia symptoms, and these drugs come with potentially serious side effects as well as the risk of addiction. So let's talk a little bit about non-medication treatments. Exercise. Regular exercise such as walking, swimming, biking is helpful in reducing muscle pain, improving muscle strength and fitness in fibromyalgia. If you are beginning an exercise program for the first time, it's best to start slowly and gradually increasing your level of activity. Over time, exercise improves fibromyalgia symptoms. Muscle strengthening programs also appear to improve pain, decrease the number of tender points, and improve your muscle strength. It can also help to work with a physical therapist to develop an appropriate and individualized exercise program that will be of most benefit to you. Eventually, a good goal is to exercise for at least 30 minutes 3 times a week. Now let's talk about relaxation therapies. In some cases, participating in stress reduction programs, learning relaxation techniques, or participating in hypnotherapies or hypnosis, biofeedback, or cognitive behavioral therapy may help to relieve certain symptoms. Of these approaches, the most is known about CBT. CBT is based on the concept that people's perception of themselves and of their surroundings affects their emotion and their behavior. The goal of CBT is to change the way you think about pain, to deal with illness more positively. CBT has been especially effective when combined with patient education, information, i.e. learning about your disease and how to manage it just like you're doing right now. Hypnosis induces a trance-like state similar to daydreaming, of altered awareness and perception during which there may be heightened responsiveness to suggestions. During biofeedback, patients use information about typically unconscious bodily functions such as muscle tension or blood pressure to help gain a conscious control over such functions. There's also Tai Chi and yoga. Some people with fibromyalgia benefit from traditional Chinese exercise called Tai Chi, which combines mind-body practice with gentle flowing movement exercises or yoga. So, living with fibromyalgia. While fibromyalgia is not a life-threatening disorder, many people worry that their symptoms represent early stages of a more serious condition, such as SLE, systemic lupus erythematosus. However, long-term studies do not indicate that people with fibromyalgia have an increased risk of developing other rheumatic diseases or neurological conditions. Most people with fibromyalgia continue to have chronic pain and fatigue throughout their lives. However, most people are able to work and do normal activities. The degree to which fibromyalgia impacts a person's day-to-day life varies, and everyone's situation is unique. Working with your doctors and other healthcare providers to understand your condition and manage your symptoms, learning effective coping techniques, and having strong family and social support can really help improve and maintain your quality of life. What can you do on your own to help? It's really important that you stay active. Walk, swim, bike, do anything you can. It'll help ease the pain. If you have not been active, it might hurt a little more initially, but it will improve as you get better. It is also really important that you try not to be too negative about your own life. Your outlook has a big effect on how you feel pain. I know it will be hard, but do your best and stay positive. This is the end of a very long, very deep discussion about fibromyalgia, diagnosis, treatment, other conditions to consider. I hope you find it useful and that it helps you talk to your providers about treatment and what will work for you. Again, for other videos just like this one, go to PatientEducation.Video. Bye-bye. If you enjoy this video, please consider subscribing and hitting that bell notification so you don't miss any new episodes.